I first got with the health underwriters, I was a part of the life underwriters, and it was really more or less just a social thing. But when I became aware of how the health underwriters was so involved in legislative issues and had such a presence downtown at the State House as well as nationally, that's what got me excited about being involved, because health insurance, as we all know, and employee benefits as well, do exist basically at the legislative process. So as we get into products and services, we're constantly looking over our shoulder at what our legislators are doing federally and on the state level. So those of us who are involved in this see this, and we're trying to get more of Ohio's insurance communities, particularly people in health and employee benefits, to see the same thing that we see, that we saw today, that we can make a difference downtown. We can have an impact as far as change for the better for not just ourselves, but our consumers, our customers. Today we had 7 legislators. We had 4 Republicans, 3 Democrats. We did that on purpose to have a bipartisan discussion on several issues that we as an association have been working on that are important as we head into next year with a new administration, with some of these folks being elected to the House and Senate. I think we accomplished what we set out to do, which was 2 things. We wanted to get opinions and statements from the legislators on some of these issues, but we also wanted to educate them as well, because some of our issues can be rather complicated. The Senate bill that has been passed in both Senate and House is going back to committee. We expect that will have serious consideration for passage, possibly in the lame duck session. What that does is it would allow employers with 50 or more employees to have access to their claims information year to year. It would also standardize a format, because right now you can go to an insurance company, and I won't name insurance companies, but you might get a claims experience that has a different format from the other 3 or 4. So not only does it create claims experience, but it standardizes the format. So if you were going to get multiple bids out and you created the same format for all insurers, that's just an easier system for the carriers. We talked about the 1332 waiver. That's, again, something that we have been advocating through the process that the Affordable Care Act set up, and that the state of Ohio will more than likely, in the new administration, look to send a new waiver request in. And we hope to be a stakeholder, as we were in the last process. And again, I think that's something our members don't know, is that we were asked, along with the Ohio Association of Health Plans, to be the major stakeholders as far as advice to the regulators on that subject. So we felt very pleased and appreciative that we were included in that process. We talked about transparency a lot. That's something that everybody seems to agree on. Everybody on the panel today thinks that not only individuals should have access to information that they're going to need to make good choices as far as their health care, but also just provide a situation where insurance companies and medical providers are working together so that information can be used to cut down on the costs, cut down on mistakes on bills, make sure that you're not overpaying for a procedure that you could have gotten 2 blocks away. Those are the things that we advocate for. We do see very positive comments coming back from the panel today on that subject. And again, that's a very broad subject. There was a statute that was passed, but it has been suspended. And we hope to take that suspended statute back to the legislature next year with other groups and see if we can make that happen. The last thing we talked about today was Medicaid expansion, which can be a very controversial subject for a lot of legislators. I was impressed with their commitment to that. They were warned beforehand, before they came here, that we would ask that question. And I thought they were very honest in their evaluation of it. I don't think anybody flat out rejected Medicaid expansion, but of course there's a lot of details that go into that. And I think, I was actually very surprised at the positive comments that came out about keeping expansion. So that was very good. Obviously, being the president of the State Association and working with the local CAHU leadership and as well as the other locals around the state, we are trying to get the word out this year legislatively. There's a lot of reasons that you could join together and work together to try to make our industry more effective, our relationships with the carriers. The more numbers we have, the more serious people take us. And I think that there's a number of people in our state and our communities who are very successful in our business, who really we should be asking them to give back like we have. So my appeal to those people is that take a look at what's going on, not just at the federal level, but the state level, and look at what we're doing to try to make not only your customers, put them in a better situation, but your insurance agency practices as well. So yes, we are definitely interested in getting the word out that we have the ear of the legislators, and we intend to get the ear of the new governor as well as the new insurance director next year. So that's my appeal to those in our industry who are not members yet. Open invitation, we'd love to have you.